is diabetic retinopathy? If I'm not wrong, I'm pronouncing it correct. And what is this treatment?
Right. So that is the eye complication that I was talking about. And again, there are two types of it, non-proliferative and proliferative. But just for general terms, we can say that what happens. So in our eyeball, in the back side of our eyeball, there is the retina, which is like the membrane on which the image gets projected. And it has blood vessels. And what happens in diabetes is that the blood vessels can proliferate. See, sugar is a good medium for things to grow. So if you keep a high sugar, the blood vessels are going to grow, the cells are going to grow. And in non-proliferative retinopathy, it may form like pouches, which can lead to swelling. Swelling in the macula. There is another membrane called macula, or the tissue called macula. And there is a thing called macular edema. What that means is there is a swelling in the retina, which can give you, decreased vision. A little bit more advanced would be the blood vessels will proliferate and they will actually break down and leak blood. And there can be bleeding inside the eyes. So this would be much more serious, and that does need attention. The bleeding can be stopped by doing laser treatment, photocoagulation. And for this, we do recommend that at least once a year, you should go and see an eye doctor. If you're a diabetic, you go and see ophthalmologist. I don't think, again, this is much more prevalent in India as much. I don't think people go to the eye doctors as frequently. They will go to check their number, prescription number, but they won't necessarily dilate their eyes and look inside the eyes. So something that's very commonly done here, but please go and do check it up once a year, because these can be prevented if they are recognized early on. There are treatments given. There are also injections now. I'm not an ophthalmologist, so I don't know a lot of details, but there are injections that can be given into the eyes, which will decrease the proliferation of those blood vessels and halt that process, so that, something worse doesn't happen, so that they don't bleed and, you don't go blind. There are people who can go blind from this. But yeah, that is what is diabetic retinopathy in a nutshell.